It is now safe to start returning to get routine care, which is critically important, especially when it comes to well child checks and routine immunizations for kids. We have seen over the last few months across the country that rates of vaccines in children have dropped precipitously. And that's really concerning to us as pediatricians because it means that we are now at risk for having outbreaks of vaccine preventable diseases, things like measles or whooping cough, that occur now on the back of this COVID-19 pandemic as well. And that would be a huge tragedy if it were to occur. So that's why we're really encouraging parents that it is safe now. We've put practices in place. Some of the things that they might see if they come to a pediatric clinic here is even before your arrival, probably a phone call or contact to make sure that you and your child are feeling well. We would still recommend if you are ill in any way that you do not come into a healthcare facility, and you can call your pediatrician if you're concerned about the symptoms that you're having. Upon arrival, another symptom screen is conducted to make sure that everyone is feeling healthy who's entering the building. And we have recommended and have a policy in place for masking of any patients and parents. So children over 2 years of age are expected to wear a mask on site, as well as all healthcare providers as well. So that's one additional way that we can reduce the risk of transmission here. There's lots of hand washing stations set up in areas for people to wash their hands frequently, and we would encourage people to do that as well. So I think all of these different pieces have been put in place that now make it safe for patients to come in. Even in waiting rooms, the appointments have been set up so that we don't have large numbers of people who are sitting in waiting rooms, and there's been distancing put in place in the waiting room settings as well to help reduce risk of transmission. So we are now comfortable that we have done everything that we can to reduce the risk of transmission in our facilities, and parents and families should feel confident coming in that all those precautions are in place to protect them and to protect our staff as well. Vaccines are life-saving interventions for children. They prevent a lot of serious and life-threatening infectious diseases that affect children and adults as well. And so when you have rates of vaccine that drop below a certain threshold, often referred to as herd immunity, you then set up a situation where you can start to see outbreaks of these vaccine preventable diseases. Measles, in the last year or two, we've had large outbreaks occur across the country. And once your herd immunity drops below a certain threshold, you really set yourself up in a situation where those outbreaks can occur. And so for sure, measles is a big one. Whooping cough, we know, kind of circulates in the community. And when you have decreases in vaccination rates, then you can see that illness affecting some of the most vulnerable groups, which are very young infants, so under 6 months of age, who are susceptible. And so we really don't want to add that on top of kind of what we're all dealing with right now with COVID-19 as well.